I want to tell you today about what I do, but more importantly, I want to tell you about how I got to do what I do. So we're going to need tools, and among those tools are thinking critically, we're going to need compassion, and as I'll talk a little about, we're going to need human rights. So, and as the slide title says, a journey in health and human rights, discoveries. Socks play an important part in this, as you'll see. So who am I? Well, I'm a physician. I teach at NYU School of Medicine and Bellevue and all those things. Where it gets a little off the beaten path, I suppose, is I spend my time caring for victims of torture and other human rights abuses. Here I'm examining a young man in Zimbabwe who was brutally beaten, had his arm broken in fact, because he had been trying to organize people to dare to come out and vote against Robert Mugabe, one of the great sociopaths of our time, who has been president forever and I guess will be president until he gets a better job offer. But along the way, we found that individuals over and over again were being tortured for simply grassroots organizing. And I'll say one of the chilling things I heard when I was asking people, why were you arrested? They said to me, well, they accused me of being a terrorist. Now, where do you think they got that from? That came, a lot of the work I do also is documenting what I never thought I would be, which is the United States' role in perpetrating torture at a level unprecedented. So I simply would say this, to paraphrase a great graduate of this institution, Stephen Sondheim, who said, "Be careful what you say, children will listen. Be careful what you do, United States, because despots will pay attention and listen as well." So when I'm going places, it's often not because anything good is going on. I spent a lot of time in Cambodia documenting the horrific health consequences that landmines, these weapons intended to stop soldiers, have on civilians, because a landmine can't tell the difference between the footsteps of a soldier and those of a child. I did a lot of my training at Bellevue Hospital, the oldest public hospital in the country, and I'm biased, but one of, I think, the greatest. It's a place where the Wall Street executive with chest pain is taken care of, and the homeless individual with maggots on their body and ulcers, and everybody is treated with respect and decency. It's truly a city on a hill, and a place in my comings and goings that has taught me a lot about human rights. So, how did I get there? Well, every journey, I suppose, starts with a step. It was back in May of 1985, and I can say on that day I truly got some direction in my life. At the time, I was a second-year medical student, and I was so sure of what I was doing. I was sure I had always wanted to be a doctor. In utero, I had wanted to be a doctor. In high school, college, and now here I was after 2 years of medical school, and I was fried, to use a clinical term. At that time, and medical school has gotten a bit more humane, though we still haven't learned the law of diminishing returns. We were just bombarded with facts, and we shoved them in and shoved out another set, and I just couldn't take it anymore. And I found for the first time, I guess I was having an existential crisis, that I was doubting what I was doing. Did I want to do this? And I suddenly thought of a gazillion things I wanted to do. Maybe I wanted to be a lawyer, maybe I wanted to be a writer, maybe I wanted to go to Hawaii and sell t-shirts. I wasn't used to uncertainty. And for those of us who've wrestled with it, it's a really, really hard space. But I do want to promise you who are in that space, if you hang in there, that's really where it gets interesting. But first, the ride got a little bumpy. Fortunately, my roommate, he said, you know, Alan, if there's something you want to do, go do it. So before the internet, I kid you not, I got a list of voluntary agencies, and beginning with the A's, international voluntary agencies, beginning with the A's, called the first one on the list, the American Refugee Committee, skipped the American Red Cross, thought they didn't go overseas, called them, and actually got through to somebody. He said, oh, you finished 2 years of med school. We need somebody to teach introductory science skills and run a medical laboratory in a refugee camp on the Thai-Cambodian border. When can you leave? One little detail, my parents. I think in my family, leaving med school in the middle of med school was as close as you can get to original sin. So I go and I talk to my dad, who's just one of the kindest men I've ever known. And he first says, so you're really going to Thailand? And I'm like, yeah, I'm going to Thailand. And he looks at me and he says, well, Alan, do you have enough socks? And I say, yeah, I have enough socks, Dad, you know? And I find we're talking about cotton versus cotton polyester blended underwear, which is best for the tropics. It's cotton, by the way. And I say to him, Dad, why are you asking me about these things? And he says, well, Alan, it keeps me from thinking about the other things. And the Tuesday after that, I was driving through the beautiful, bumpy countryside of Thailand. We come to this set of barbed wire fences surrounding what is rows of bamboo huts. And we drive in, and this is what I see. I mean, without me standing there. I had nothing in my context with which to compare this. And my head was spinning. I was dizzy. And everywhere I looked, I saw these little kids waving their hands, and none of them had shoes. I saw limbless men, like the picture before, and women who'd lost their limbs to landmines. And I was like, wow, where am I? You know, it's sort of like, you're not in New Jersey anymore. I loved what I was doing. I felt I got up in the morning and got to do something important. I also learned when you go overseas and you do this work, you need to do it with humility. Because I was there for a little over a year, and after 3 months, I thought I knew what was going on. After 6 months, I realized I knew absolutely nothing. And after about a year, I thought, well, maybe I can frame the questions. So another key thing about education and learning, it's humility and how to frame the questions. And some of the questions I learned to frame, which inform my work, are how to take a trauma story, how to hear these horrible things, because every Cambodian I worked with had their entire families slaughtered through war and other atrocities. And I used the wrong term, take. You don't take a trauma history, you listen. Something we're not always that good at, but I've learned to listen. When I was in India doing a study documenting the prevalence of torture among Tibetan refugees, I'd wanted to meet the Dalai Lama, and so we're whisked into his office and into the Buddhist equivalent of the Oval Office, and in he walks. And people ask me, what's he like? I said, oh, he's very tall. He's really not. But I was taken aback, and we had an interesting discussion about karma and torture, and he said, you know, torture, it's not a punishment. Karma is just what it is. And maybe it means you need to speak out. And he then turned to me, he said, regarding what you see, you must not whisper, you must not talk, you must shout. And you must shout loudly and smartly. And I've carried that with me. But when I came back from India, my father, may he rest in peace, said, well, you know, you can never have too many blessings. And so that's where I leave you. We can never have too many blessings. We can't have too much information. We can never have too many questions. And maybe, just maybe one of those days, we will find the answer to that most difficult and challenging of questions, namely, what happened to that other sock? Thank you.